Hi everybody, I'm here again. My name is Lorena Duarte. I am a veterinarian from Brazil, and I'm here today for my second presentation of the Unit 640. And today we will talk about emerging infectious disease in wildlife. So, history of emergence of diseases. Basically, this is a natural event which has happened since thousands of years ago. However, nowadays, it has been more evident because better diagnostic methods and also mainly because of the anthropogenic actions. It will rely on susceptible hosts that may arrive through immigration, immune status change, or even a birth of new susceptible individuals. And also, it relies on the ability of the pathogen to spread. The pathogens will persist in a population only if an infected host on average is able to infect one or more susceptible hosts. If one infected individual is not able to infect at least another one, the disease spread won't progress. As the pathogen is spread in the population, the number of susceptible will naturally reduce for the immunity creation or the death of the diseased ones. Therefore, the disease has a trend of being naturally controlled in closed populations, which explains why small human communities years ago have had main outbreaks caused by reintroduction of a pathogen, likely from wildlife. Main factors responsible for emergence of infectious disease in wildlife. Nowadays, anthropogenic factors are the main responsible for emergence of disease in wildlife, basically man-made actions. So we have as a topic ecosystem modification, and we have as an example creation of artificial lakes to domestic waterfowl, which attracts also wildlife and allows contact between different species and also transference of pathogens from domestic animals to wildlife. So basically, humans create lakes with domestic ducks, just for example for paisagism to make the place beautiful, and this lake ends up attracting wild animals, and the contact between the domestic animals and the wild ones may be responsible for the transference of pathogenic agents from the domestic ones to the wildlife. We also will have climatic change as one of the risk factors for the emergence of disease in wildlife. For example, the increase of the rain may have as a consequence the increase of the grass that will be feed for rodents. So the rodents may have an increase in population size, and this may increase the likelihood of contact between different populations, and of course it will increase the risk of transmission of disease between these different populations. Pathogen movement among different geographic areas and species. Basically, before we could say that birds were the main responsible for the spread of pathogens in different geographic areas. However, now the globalization with the trade, we can infer they are the main reasons for the pathogen movement and transmission in different species. The vector's movement may be a consequence of change in the weather or the climatic change that may stimulate the increase of these vectors in new areas, or only as before, it can be a consequence of globalization and trade, and of course it will increase the risk of new disease appear in wildlife or even in humans. Reassortment, mutation, or recombination of pathogens that are natural evolutive mechanisms that pathogens will use as an attribute to keep themselves alive and able to infect new populations. Now we will talk a little bit of one disease which has affected a wildlife species, especially in my country, Brazil. This disease is the yellow fever, and the animals affected are the holy monkeys, who are these beautiful guys in the photo, as you can see. So yellow fever was firstly reported in Yucatan, Mexico in 1648. In Brazil, the disease arrived only 37 years later in 1685. we have had reports of fatality rates up to 51%. And in Brazil, we had a very famous doctor called Oswaldo Cruz. He is considered the father of the Brazilian epidemiology. And in the 1800s, he launched a campaign based on control and prevention, focused on the control of the vector of the yellow fever that are usually mosquitoes. And after his amazing work, Brazil had a silent epidemiological of 150 years without any cases of yellow fever. But unfortunately, after this, the measurements of control and preventions, they weren't made in a very responsible way, and unfortunately we start to have disease cases again. So yellow fever is a RNA disease, and the virus belongs to the Flaviviridae family, being an arbovirus, which means transmitted for arthropod vectors. So we can see as well there is a vector-borne disease. The main vectors involved in the transmission are the Aedes species, Aemagolus species, and Sabets. The occurrence relies on presence of tropical weather, what is indispensable for the reproduction of the mosquitoes. So the clinical signs of the disease are mainly fever, abdominal pain, jaundice, vomit, headache, and hemorrhages. The transmission cycle of the disease happens mainly in rural or bush areas, usually, so we call this cycle sylvatic. But it can also happen in cities, then we call urban cycle. The diagnostic may be serological, where we will try to find antibodies against the virus, or direct, when we'll do the isolation of the virus. Monkeys are the reservoirs of the disease in bushy areas. Some species present an apparent infection, while others are severely affected, manifesting all clinical signs and evolving to obit. So these monkeys will be the species that are mainly affected by the disease that I was trying to talk in the beginning. So in Brazil, these species, the holy monkeys, they are endangered. So they may be extinct, and the yellow fever may be a potential risk for this extinction. Happens very, very soon, unfortunately. Here we have a picture of one of the workers of the Department of Health of the Brazilian government collecting a dead monkey to investigate if it was infected for yellow fever virus. The Brazilian government doesn't do active surveillance for disease. It means that we don't go out testing monkeys randomly. However, if a dead monkey is found or reported by the population, we must test it for yellow fever and adopt all the measures of contingency if the monkey is positive. So basically it will be focused on the controlling of the vector. So that will be through poison sprays with long residual effect. Education in health of the population to avoid accumulation of water. That is the main reproduction requirement of the vectors. And also vaccination campaign in the affected areas. So there is a human vaccination available. So as I said, there is a human vaccine available. It is provided for free by the government. People will need 2 shots with interval of 3 to 4 weeks between them. And the vaccine will provide protection for 10 years. People who are allergic to eggs, they can't receive the vaccination because of the constitution of the vehicle and the whole vaccine is a product that contain those eggs specific pathogen free in their constitution. Prevention of disease in monkeys. So there is no prevention of disease in monkeys. In Brazil, no measures to prevent disease in monkeys are adopted at the moment, especially because these animals play an essential role to alert health authorities that yellow fever virus may be circulating in that area. So they are very important for the surveillance. They are considered sentinel species. Many species of monkeys are endangered in Brazil, facing a possible extinction in the next few years. This fact creates a demand for further studies about the dynamic of the disease in this endangered species. And one of these species is the holy monkeys, who are severely affected by yellow fever, and most of them, up to 92%, can die if they are infected. Now I will talk about a wildlife species who may be involved in the emergence of infectious disease in humans. The example of pathogen that I chose is hantavirus, and in Brazil we will have 3 species that are mainly correlated with the spread of this disease. So they will be Rattus rattus, Rattus novergicus, and Mulus muscus. They are all rodents, and they are the main responsible for the spread of the hantavirus in Brazil. The disease caused by hantavirus was firstly described in China around 1,000 of years ago. Now we can find it in anywhere pretty much, a visible result of the globalization and trade between different countries. So the main relevance of hantavirus in humans is because there is no specific treatment and no cure. Hantaviruses cause 2 clinical syndromes in humans: hemorrhagic fever with renal syndrome, and its mild form called nephropathia epidemica, and hantavirus pulmonary syndrome. The type of disease presented relies on the strain of the virus infected in humans. So some people may have severe disease and some people may have a little bit mild, and it will rely on the strain or the type of the virus. Hantavirus disease is caused by a RNA virus from Bunniaviridae family. Symptoms in humans are responsible to cause death and are basically pulmonary edema, respiratory shock, and heart failure. In humans, rodents, however, do not present any signs of disease, so the rodents, despite of infected, they will look healthy. Transmission in humans happens through inhalation of aerosols contaminated with excrets from infected animals. Bites are the main form of transmission among rodents. There is no vaccine available, and diagnostic in humans is mainly serological. Prevention and control, of course, will be focused on control of rodents around human installations based on a simple principle. There are mainly 4 things that being avoided will not permit rodents' development in that area, and these things are no water available, no food, no access, and no shelter. So basically, if the rodent can't come in, can't find food, can't find water, and can't find shelter, the rodent will go and will not develop its colony in that area. Surveillance and control. Rodent control is a common practice in Brazil, being broadly addressed by the health authorities, since many other pathogenic agents can be transmitted to humans from these creatures, including Leptospira. It's based on earlier detection of human cases of disease with effective treatment at the time. People are the main responsible for the primary notifications of the suspect case, since there is no active surveillance for the disease in Brazil at the moment. Health education of the population is very important also, because when people are aware of the cause of the disease, transmission method, and prevention, they can be powerful allies to fight in the combat against the pathogen hosts and vectors. Emerging disease in wildlife. Now we have a greater prevalence than centuries ago, and there are some possible reasons, like better diagnostic techniques, and of course anthropogenic actions modifying environment and weather, which facilitates contact of new pathogen agents with new populations and result in emergence of disease. For the future, we have the alert that novel pathogens will be mostly viral from wildlife and possibly RNA. Based on this, it is indispensable better understanding of the wildlife animals as a whole. Conclusion. Unfortunately, there are far less publications related with wildlife than domestic animals. We have a whole world to explore to better address the diseases transmitted from and to these wild species. Understanding of the immune system of hosts is necessary to understand better the dynamic of disease in wildlife. Active surveillance in wildlife needs to be done. Further studies focused on wildlife disease are required also. Thank you so much, guys. Here are my references if somebody wants to check or to read a little bit more. Thank you for your time and your attention. And I hope that I have brought some new information to you. Thank you.